Hi everyone, welcome to Dust Live. We're just going to take another 5 to 8 minutes to start our discussion. But thank you all for joining in. Thank you all for being so on time. And I think we want to take a few more minutes because I think we're expecting a lot more people to join us in today. And we have a very exciting lineup today for our Monday fix. Before we start, I thought I'll do a short recap and tell you guys that we've had some really interesting programs the last couple of Mondays. We've really particularly focused on COVID, the COVID crisis in front of us. And we are focused around how it's impacting our lives in terms of things that we don't really see. So, for example, we had a really interesting discussion 4 weeks ago on the government's efforts, how COVID is allowing government a new license, a fresh license to surveil people, the health license, the public health license of surveillance. And we had Lawrence Liang and Sanjay Bhangar, and it was a really interesting discussion. It's on our Dust Live YouTube channel. Please go and listen to it. We followed that up with a really interesting second discussion a week later with Gurshabad Grover of the Center for Internet and Society, where we talked about how the government is censoring our internet use on a daily basis. And these are really important discussions today because while we're also distracted by this huge pandemic in front of us, the government is slowly eroding our rights day by day. And we followed that up with another discussion with Meenakshi Ganguly, the current South Asia head of the Human Rights Watch, on human rights during the pandemic. I mean, the number of people who remain in jail. I mean, there are shocking reports of, I'm sure you all seen a report recently of a social worker who was defending a rape victim in Bihar, was arrested for contempt of court. And while the rape victim was released on bail, the social worker is still in jail. And this is the way the state is exercising its control. Varava Rao has thankfully has been released to hospital care, and many more people remain behind bars. We tried to do a really interesting discussion. We were all looking forward to last Monday with Professor Nandita Haksar, and sadly, internet failed us and the powers that be. And we're really trying to get that on board again. It was a really interesting discussion with Vikram Doctor and Nandita Haksar on a new book on the politics of food. And it's a very important topic. And I think, and again, Haksar's work ties up so much with what we're going to do today, because our today's discussion is really about the COVID pandemic. And Haksar actually single-handedly led this initiative to send a whole bunch of Northeast Indians from North Goa back to the Northeast. And she wrote a very powerful piece in Scroll about the very difficult train journey they had. So if we are continuing these discussions, and I'm going to move on to today's discussion today, this is a really, I'm really excited about today's discussion because it's slightly a fan moment for me because, and I know these women are not, I didn't actually prepare them for this at all. So it's good I'm catching them off guard because when the first lockdown happened on March 22nd, a lot of us sort of were grappling with what's happening around us. We obviously, when we look back in retrospect, we had no idea our lives would be here today, right? And we had no idea that moment how things were going to be in the next 3 days. And I think for me, I wanted to do something. And a lot of us wanted to do something. And I think certain people in our villages, in our society in Goa took the leadership and showed us what can be done. And we're very lucky and very fortunate that, there were many such leaders, and we have to acknowledge that, but 3 of them have come today on this platform. We have Miriam Koshi, Nupura Hatamaki, and Vijaya Josephine Pace. I know Vijaya doesn't like to need to use a second name, so I did that purposely. Just to quickly introduce, these women have illustrious careers, so I can't really go into them so much. But Miriam, as you all know, is a curator, as a gallerist. Nupura has been a consultant for decades, and is now in Goa. And Vijaya, I guess the best way to put it is Vijaya is somebody who connects people through Offbeat Goa. She gets people connected. It's a really brilliant thing that she does. And for all of you here, don't get confused because we are trying to beat the algorithm of Zoom today. So all of us have logged in through multiple windows just so that we make sure that we are there. So don't get confused by diabolical twin identities on Zoom today. Anyway, so we're going to have a sort of open discussion, and and we're going to try and break it into 3 phases. We'll start with the first phase of the lockdown. You know, the first phase, which I'm calling the phase of hunger, when we all realized that suddenly people were hungry, they had no food. And how did the government and the administration not think of it? How did the lockdown convert into a public crisis? And also, at what point, I mean, this is something I really want to ask Miriam, Nupura, and Vijaya. At what point did you realize that something was seriously wrong, or we were at the brink of a disaster and you had to do something? And I'll start with Vijaya.
So how it started for me was the day before the day the Janta curfew was announced. I don't know, I just had this feeling like, okay, I think this is the last day that I'm going to rest and something big is going to happen. And I remember I have a volunteer WhatsApp group and I put it out there, and Nupura and Malan were like, yes, let's do something about this. And then Sanjeev from Sensible Earth, like the 4 of us, 5 of us got on call to discuss what we could do, because all of us, I think, felt like there was going to be like this impending craziness coming upon us, but nobody really could foresee what was going to happen. For us, we thought, you know, it's probably like the elders in the community that are going to be most affected. So let's try and do something for them. And we decided to put this helpline together. You know, Sanjeev has this amazing tech background and all of that stuff. So he got this helpline organized, and we collaborated with the CCP, the Corporation of the City of Panjim, and the whole Sensible Earth team got on board. And, you know, we put this grocery post out. The CCP was actually the first grocery post that went online on Facebook. And the food crisis sort of happened at the same time, where everyone across Goa suddenly had no food. So when this post went out, we were just a bunch of like 4 or 5 of us, I think, on calls that morning. And we were inundated with 40,000 phone calls. The phone just wouldn't stop beeping. It was like buzzing, 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 nonstop. It was just insane. And we got more volunteers on call after lunch. Then there were about 10, 15 of us. And we just like, it was a very reactive sort of situation. It wasn't like we had time to plan and think like, this is how we're going to address the situation. It just came upon us like some sort of tsunami, right? And we had to keep changing plans on the go. Everything was like on the fly. And so these people that were calling us were just distressed human beings from all across Goa. But since CCP was only servicing Panjim, the people from the other parts of Goa, like, we didn't know what to tell them. So we started collating information. And then again, so the whole thing has been a very collaborative exercise, collaborating with a whole load of people from across Goa. A lot of like, you know, people just came up and started volunteering. There was Act for Goa, Jill. She had, you know, like put together, collaborate, like a list of services. So we used her list. So anyone who would call from anywhere that was not Panjim, we would give them whatever information we could find. And it was just, the first 10 or 15 days of that lockdown was just insane because there was no food available. Every panchayat had a different story. You know, one panchayat was giving food, but at some inflated rate. Another, like 10 panchayats would have no food. It was just insane. There was no way to keep track of what was going on. And just trying to disseminate information, I think, was the hardest part for us.
And this is very important that you're saying that, Vijay. And I want to, you know, I want to ask this question to Miriam. I mean, we saw that, right? We saw this sort of like, we saw a disparity in the way in which the panchayat administrations collapsed, like, or the talukas. I mean, can you comment on what happened to Bardes? Like, why did Bardes fail so miserably?
I think they were basically not prepared at all, and the attitude I felt was quite lackadaisical. So when we had our first meeting there, we went with a lot of hope that, okay, now finally we're going to give our lists. We've given our lists, and things are going to be looked after now. But when we went there and spoke to them, they said, we need help. Like, we don't have manpower to handle this situation. So you guys continue doing what you're doing at your end. But we are really struggling. And we could see that because the issue was that they'd have just 7 lines for the food helpline. And on those 7 lines, most of the time, those lines would not connect. There were people manually
Who were
taking
you
down
speaking to
those.
in the administration? Sorry, who were you speaking to in the administration at that time?
This was Akshay Potekar.
So this is the collectors, the collector.
Yeah, deputy
Okay.
collector.
Sorry.
So he said, we need help. Will you come and help us? Will you be with us from say 8 a.m. to 11 p.m. at night? So we said, okay, we are a group of volunteers. We can help you with the distribution. We can help you with the lists. But somehow that never really took off. We did submit all our lists. We registered them on the food helpline, but the response was always inadequate and irregular. So we kept getting calls and we kept having to step in and fill in all those gaps, and they were huge gaps.
Can you give me an example? I mean, I mean, sort of an illustrative example of what really happened. Like, what was like to understand the scale of the situation? Because I think for a lot of, I mean, for a lot of us, we know what happened, we lived it. But for a lot of people who didn't, to really sort of understand what was going on, the lines of people looking for food. I mean,
so we'd go in, we'd get a call from a community, and they'd say, so hey, we're about 20 people or 30 people, and they'd send in a list of 20 or 30. But when we'd reach the spot, the 20 and 30 would turn out to be 200. And that didn't just happen at one time, it kept on happening. So whenever we went back to that community, there would be a further increase. So, and most of the times there were 100% and even 200% increase in those lines. So we always went prepared with extra, but we had to keep running. It was a treadmill that never ended, because we've gone for 200, there are 600. Now we have to go prepared again prepare in the next couple of days to go and feed the rest of the 400 that we just registered on that day. So these lines, and it's not something that was limited to, say, the beginning of the lockdown. This kept happening right through.
wow.
So the scale just kept increasing.
On this point of the scale increasing, I mean, I know that, you know, I mean, Vijaya and Nupura were one of the founding members, as Vijaya mentioned, of the Goa Humanitarian Helpline. And Miriam started COVID Outreach Goa. Nupura, can I sort of, I mean, when did you realize the need that you had to create an official platform? That this is not something that you can do as an independent volunteer anymore?
I think the first day when we took started the helpline for the CCP groceries, like Vijay mentioned, there was 5 of us taking calls. I was one of them, and the phone just like rang non-stop. Like we couldn't even go, you know, because at that, and this was the first day, so we hadn't even learned how to log off the system. So even to go to the loo, we couldn't, because the phone just kept ringing. And it was people panicking from all across Goa. And we were just helpless to tell them, because if they were out of Panjim, we were like, we don't know anything right now, we'll get back to you. I think that's when, you know, me, Vijay, Sanjeev, Malan, I think was there, and Aisha. And we were like, this is not going to be done with just 4 or 5 of us. This needs a whole team. This will need major fundraising. This will need major logistics, because the other issue in the first 2 weeks was, even if you do fundraising, where do you buy rations from? So, which is how then, you know, we kind of made corporate lingo department heads. So like Vijay and Varun were handling onboarding volunteers and, you know, identifying which villages they'll be the champions or the spark. So my predominantly in the earlier days, my job was to find supplies. So the first week, I remember we managed to find a supplier in Belgaum through a connect, and he managed to get a permit for a truck, because every supplier in Goa either claimed they have no stock, or they claim that if they have stock, it's been told to be kept on hold for the panchayat or whatever. So we got a truck full of like rice, dal, onions, potatoes. That was how the first GHH food bank was set up, with stuff from Belgaum. So we had to, but we realized we had to streamline, and everybody had to So then again, the other part of my job was talking to hotels, restaurants. Can you provide free cooked meals, or can you donate, supplies that you're not using?
What was the administration doing all this while? I mean, I know you guys were just responding to this enormous kind of need in front of you, but what was the administration doing?
To be very honest, in the first week, 10 days, I thought that, this is a surprise for them. This is a crisis that has never happened in the world in decades. So everybody's scrambling. So they'll take a week, 10 days to settle in. Private enterprise always works faster and better and more efficient. And since I have been doing marketing and events, I have a lot of corporate clients, vendors in every city. I can source this. So it'll be a week, 10 days max. After that, the government will have machinery in place and it'll smoothen out. Unfortunately, after 3 months, I've realized that they either didn't care to do about anything, or they just didn't want to do anything, or it's a combination of both, or it is just that even if they want to do anything, they have, pardon my French, idiots at the ground level who can't seem to get anything done. And the corruption, let's not hide behind that. There is loads of corruption on ground. We have seen enough stock there, but not there for the people who need it.
Let's come to the stock issue, because I want to come back to that, because that was something that we did discuss in a prep talk. But Miriam, when we were discussing yesterday on Sunday, and you said that, how did this become a crisis? I mean, this is something we need to reflect back on right now today as an instructive lesson. How did we let this become a crisis? I mean, how did the government let it become a crisis?
Yeah, so like we discussed, I don't think it was so much a COVID crisis as an administrative crisis. So I don't think the government itself was aware of the huge numbers of workers that existed, because their records, they don't have records of them. And whereas there is this, 1979 Act, the Interstate Migrant Workers Act, which says that the contractors are supposed to make records or to, register workers. So if this registration had been done, and they would have had the numbers and they would have had some semblance of preparation. But I think they were just as much shocked by the numbers as we were, and they just could not.
The numbers, Miriam, can you give us the numbers? Because there were some numbers going around. The labor minister thought there were X number of workers in Goa, and then all the census that was done it came to a different number. What were the numbers?
So it started at 80, but it was about 1.5 lakhs.
So basically we were at 50%.
Yeah. Yes.
Wow. Vijay, do you remember some of our discussions during the first phase of the lockdown when we were trying to trace migrant workers, whether they were getting food? And do you want to share some of the story, any one story about especially construction workers on construction sites?
Yes, that was actually quite insane, because while we were at the front line having to bear and speak to people who had no food, they were desperate to go home, they couldn't go home. They were actually kind of kept like bonded laborers in these construction camps. And the weird part were there were these articles, and in fact, Nupura just shared one this morning from the GCCI president, saying that, these guys are being fed, I don't know why they left, and, all of that. And there were all of these articles that were coming out that were really riling us up, because we're like, hey, come on, we are out almost every day, feeding so many people, especially the ones who worked with the construction companies and other big businesses and industries and companies, and they were not getting paid. They weren't even getting food. And when the Shramik trains and stuff, actually they opened it up, they were not even allowing them to leave because they were afraid that work wouldn't get done. So they, so Alok, I think you did quite a bit yourself to try and get help to a bunch of laborers at one of the
I have a
construction
site next to my house. So every time on the migrant support group, I would get a message about the train. I would go up on my terrace and shout to the workers saying, "Aaj Jharkhand ka 2 train hai." And the Jharkhand workers will wave at me. And then the Bengal workers will say, Bengal ka train kabhi hai, aisa abhi nahi hai. So, you know, it was sort of a weird interaction. But anyway, but I mean, this is a really instructive point though, right? And we're all talking about this. And I think this is also all of us, a collective experience for all of us, that in many ways, we had no idea that there are so many migrant workers working in Goa.
No,
And what does it say about us?
You know what I realized when the initial lockdown started, and when there was that food crisis that affected everyone, including the middle class, because all the supermarkets were shut, every grocery was shut, everything was shut. And the middle class have access to social media, and so they got on social media, they got on Twitter, Facebook, everywhere, called higher ups, called whoever you could call up, and put pressure on the system and said, hey, you know, we have no food, we have no food. And in about 10-15 days, of course, depending on which panchayat where you live, we started getting food. We started getting food in about like, you know, at some point. And things then settled down. And because I have this group of Beat Goa, I can sort of, I communicate with people, right? And then I asked them, I was like, so how's lockdown going for everyone? And everyone's like, oh, yay, the sky is, you know, blue and everything's perfect. And I was like, okay, because there's this huge population of people that are not on social media, and they have no food. They have no food, no access to a crib or vent their frustration to anyone. You know, somehow we managed to get through to them, either through the helpline or through Miriam, you know, like just finding people, and then finding 5 people, and then realizing there are 500 people, and then, you know, 1,000 people. And it was just so distressing to see this huge gap between classes. I mean, I, for one, have never experienced something like that before. And it was a serious reality check for me personally. It was a serious reality check.
Miriam, was it a similar experience for you? When you actually went out in the field and you saw the scale of the workers, was it really that shocking?
Yeah, it just kept getting more and more shocking, because so it started with one community, and then that community would connect me to another one. And so every community we went, like I said, it just kept on increasing. And everyone would say, but hey, we have a set of our Rajasthani guys in Shorao. That's another 200, another 300, another 500. So by the time we, I think we reached about 8,000 where we kept count. And after that, we just stopped counting. We stopped counting because then, of course, relief went through a whole series, right? From food to travel to livelihood. It just kept increasing. And then recently now with the containment zones as well, there are about 2,000 families stuck at Mangaur Hills, and they are, the councillor called up and said that they are getting completely inadequate ration. They're getting about a kilo of rice for a family, and it's supposed to last them a week. So this was the last bit of relief supplies that I had, which I sent out to them a couple of days back. So yes, the scale has been mind-boggling. And did we have any idea of the scale? No, because the issue here is that they are all unregistered, right? They're voiceless, they're unregistered, faceless, and that is the moot point. Because they're informal workers, there is no visibility. We don't know about it, the government doesn't know about it, but they're here. They're being imported from villages in, you know, huge groups and bunches, and they're used for a certain period of time and then told to leave. And because they're kind of cycling all over the country, they have absolutely no rights anywhere, not in their home state, not in their host state. So there's this huge amorphous group of voiceless, invisible people. And that's what hit us when we went out on the field.
Nupur, I want to shift a question to you now, because, you know, I'm sorry, I'm switching my video off because I think the internet is a little unstable. I mean, you said earlier about, you know, the stock, right? And this is something we discussed on Sunday also, and I want to come to that, right? So you said, okay, fine, you gave the government, the administration a 1 week leeway. You said, okay, fine, let's give them a week. Maybe they'll figure it out. I want to ask you, And as Miriam said that, they didn't have the numbers, there's a 1979 Act. Suppose they have the numbers, okay, and they get their act together. Is there a provision in law for the government to access funds to provide food for migrant workers in a crisis like this?
Okay, so let's take just this one report, right? After the initial April, for the people who have ration cards, the central government said you will get rations for 3 months. Then they realized the migrant workers don't have ration cards where they are living. So I think May and June he announced that that Atmanirbhar scheme or something where basically you don't even need a ration card where you're of the place you're staying in, or anything. If you have an Aadhaar card, even if it's from say UP but you're living in Goa, you were entitled to rations. Okay. Now Goa government collected 100% of this ration from the central government, but did not distribute even 1% of it. And their excuse on this press article report that came out is that this is May. By then most migrants had left on Shramik trains, and which is absolutely false, because if that was the case, until June we wouldn't all be scrambling around and calling everybody, ensuring panchayats are open for the second round of registration, ensuring shelters are open, doing more fundraising for kids for trains. So let's assume that even because by then we had a lot of the data, we had given them a lot of the data. In fact, multiple times, that was the other thing that really pissed me off, because it would be like 1 step forward and 4 steps back with them. When our volunteers would go meet these guys, the collectors, they would be all like very accommodating. Listen, yes, we'll do this. Yes, we'll do that. And then the minute the meeting's over, and the volunteers who were representing us at meetings would put on the group that, okay, this is what was discussed, this is what has been agreed upon. And then the next day, there's a totally opposite action taken by the same collectors, right? So multiple times we gave them lists of data that we had, like all of us citizen on-ground volunteers had collected. But nothing happened with it. So it's not like if they had data, they would have done it. I think it was basically that this whole even the apathy, the lack of total concern. And initially I thought it was like because maybe they're migrant workers and not Goan, but the more I went on field, because even now the GHH food bank is still on for senior citizens who we've been giving rations from week 1 of the lockdown, and now the only difference is I go monthly and give them. But the point is the poor senior citizens who live in poor areas of Mapsa or Giri or wherever, they don't get. Then there are lots of Goans. If they are from Vasco, but their ration card is from Vasco, but they live in Para, they don't get any village panchayat support. So it is a very politically motivated way. Like villages that have done work have done it in a very politically motivated way. I don't know of any village that has given, irrespective of whether you're Goan, non-Goan, outsider, insider, like, okay, we'll feed everybody.
So I want to ask you this question, all of you. I mean, tell me the good side of this narrative, right? I mean, you told me this, that a whole bunch of people reached out to you saying that we want to make a donation. So like, your food banks, the food banks that you're running, are they supported by donations from people living in Goa?
No, all across the world.
And what was that? All across the world, okay. And how is that? I mean, in many ways, I think most people can actually the best way most people can actually be part of something is by donating, right? Am I right?
True.
And so I think, and how was that experience for you guys? Obviously, because without that, you wouldn't have been able to run the sort of the large scale thing you've run.
So a lot of the initial donations did come from people living here. Also like for example, Burger Factory, I called up Mayank the first day, and he was like, I have 100 kilos of potatoes lying in the store. You can take them. And since Anjuna, I live in Anjuna, and it's like, because this was, like I said, this first or second day of the lockdown. So driving out was not really, permits had still not been got and all that. But I was like, okay, Burger Factory is right there. I can quickly go. At least I can distribute potatoes to the cluster that's behind my house. right? So a lot of businesses, a lot of local people, like people donated soaps, hotels and all. Like I remember Maria and me were just calling hotels and everybody, you have toothpaste, soaps lying, for in-room guests that you're not going to use, please donate. So of course, a lot of in-kind help, like Saurabh of Park, I don't know how many cooked meals, Praveena of Lazy Goose, how many cooked meals. So there's loads of people, I mean, I'm having a tough time to mention all, but a lot of them just, offered kind. A lot of people, yes, did donate money. But in the last 3 months, the long term, like, because let's be honest, for example, an Aradi feeding, the Kandolim, which we do every week, just that feeding would be worth like 1,60,000 rupees weekly. Kolva was another 70,000 every week. Anjuna was another 45,000 every week. Not to mention about the 4,000 weekly SOS calls on the helpline that individual families that we would cater to. So just GHH on a weekly basis, in the first 15 days, it was nearly 10 to 12,000 people, I think, that we have fed. And then throughout April and May, about 7 to 8,000 people a week. So then,
what is
of course, we
GHH's
start
daily
reaching.
budget? What's the daily budget of GHH? Sorry, I'm interrupting.
So like I said, the weekly budget in the first few weeks, if you look at even 10,000 people on a weekly basis, I think the first few weeks we raised, I think Sanjeev predominantly did most of the fundraising then. I wasn't so much into that. But I think we had raised nearly some 15 odd lakhs. And then another 50, I think overall we must have raised close to 70, 80 lakhs. I think, Vijay, you might have a better figure on that because I was not so much handling the accounts.
No, I don't have a, but towards the around April, May, we started fundraisings very specifically, certain amounts, and the amount would go straight to our wholesaler. And that's pretty much how we were doing it. We were like creating targets of how much we needed to raise. But of course, like we would say, okay, there are these many people, but by the time we'd raise that much, there would be like another 2,000 people. So then we had to keep scrambling for funds. So it's
I know Pooja Mitra is in the audience, and I know that Pooja actually came up with a very creative idea, and she made these sanitation kits. And I remember Ferdy and I were putting them together, and just like toothpaste, and sort of sanitary needs of women and migrant women, migrant men, and I thought it was really interesting because I think sort of going beyond just the need of food, because people were obviously they needed everything, right? Can you guys hear me?
Yes, we can.
Yeah. So, listen, I want to like sort of steer the discussion towards the second phase now, and I want to talk about the Shramik trains, because I think, and I think this is really the sort of the strength of this sort of collective you guys formed. That as the situation in front of you changed, you guys found creative ways of confronting the new challenges, and so you kind of, and I think that's when I actually joined the groups. Nupura, can you put your video off, please? Has Nupura's video frozen?
Yeah, it looks like it has.
Yeah, okay, fine. She'll come back. Nupura, if you can hear us, just switch off your video. It'll be easier. So I wanted to start with you, Miriam. Like, tell us about, then suddenly, tell us about the Shramik trains before the Supreme Court order and then after the Supreme Court order. And I think because, my experience as a very external remote volunteer was, I thought that you guys are working well with the administration, but obviously your experience on the ground front line is very different. So please tell me about that.
So right up till the Supreme Court order, we were pretty well coordinated with the district administration. We would send in lists. We would, in the format that the government wanted, we would collect the data, and of course, there were multiple points at which this data was collected. There were the panchayats, there were, of course, the collector's office, police stations, and then there was us. So we did it as a backup, and it's a good thing that we did it because a lot of the data a lot of groups told us that though they had registered en masse at the panchayat, only half of them got SMSs when it was time to leave. And during one of our meetings at the collector's office, it became evident that there had been some loss of data. So what we would do, of course, is collect it in their format and just mail it to them. And however, there was a lot of completely unnecessary.
Miriam, can you put the video off? Miriam, can you put the video off, please?
Sure.
Thank you.
Right. So a lot of the confusion could have been avoided if things had been, if information had been flowing in an organized, scheduled manner, because telephone numbers were collected, yet none of the workers got information, just say a few hours prior to leaving, and they would have to scramble to wrap up their belongings, pay the rent, and hire taxis and buses at large sums of money to reach the railway stations, only to find that they would not get a chance to get on board. So all this was completely unnecessary because they had the information in front of them, and they could have very easily scheduled it and told the workers that, okay, on this date, we are allotting, say, registration number X to registration number Z tickets, and the rest of you can expect to go on such and such a date. But none of this happened, and this just resulted in a lot of trauma, because people left their rental accommodations and were on the streets. Then came the stage where they all started heading towards the holding areas in the stadiums, and again that would lead to mass confusion, because at the stadium they're not really holding areas, right? So they would start with, again, 2,000, but then the numbers would swell up by evening to 3 or even 4,000 at some times, resulting in a lot of problems in terms of sanitation, in terms of food, etc. So we were kind of parked outside these stadiums and shelters most of the time to keep an eye on these numbers and rally up meals as we saw those numbers swell, to fill in the gaps. And all
I want to just underscore this, Miriam, a little bit. I want you to emphasize this. I mean, I think one was the struggle to get on the train, right? Mm-hmm. And then the other was the indignity of not being given even food. Yes. And you know, how the Supreme Court order changed that. But before that, I mean, the idea that people were expected to travel for 3 days, 4 days back home with no food and water. And when you first realized that, I mean, that pressure, I mean, I want to understand how you guys responded to it.
So by this time, all of the CSOs were coordinating, because the scale of the problem just was getting larger and larger, and there was a lot of chaos around this travel, around people's movement. So we assigned the work between ourselves. I took up shelter patrol with my group of volunteers, and another set of volunteers took up making food kits or travel kits for workers boarding the train. Because from the initial set of workers that left to board the train, we were continuously getting reports of not even being given water, not even being allowed to get off at stations to get water, or water not being available. And this was reflected in the RPF reports of 80 train deaths due to sheer exhaustion, dehydration. And so we started rallying up in terms of sending them with travel kits. And the administration was okay with most of this work. But however, when the the Supreme Court order came, we were told any more meals at the shelter.
Excuse me. Sorry. Can I please request all the attendees to please mute your mics, please? Anybody who's attending the talk, everyone, please mute your mic. Please, thank you so much. We have disturbance coming from somewhere. Please mute your mics. Thank you so much. Sorry, Miriam. Thank you.
Okay. So what?
There is a Denise DeMello. Can Denise DeMello mute her mic, please? I'm very sorry because it's disturbing the conversation. Thank you so much. Sorry about that.
Yeah, so once the Supreme Court order came in, we were told that we could not distribute, the government would, the SOP was that the government only could distribute meals at holding areas, at railway stations, and at these shelters. So we were asked not to do so. However, we continued to do so by standing outside these areas. Because it was clear that they were not being fed inside. So we would carry a certain amount of supplies with us and stand outside and tell them to come outside and take it. So we had to kind of do this whole, behind the scenes activity just because we were told of supplying any more help within these designated areas. There was this time when we went to the Karmali railway station. There's a holding area of about 300 people. They were sitting there with just a pav since morning. There were kids over there as well. I had a truck full of food from the Sikh community. We had carried cooked food with us, but all of them were told to sit in their seats and not move out. Neither were we allowed to go in and give the food. So this whole thing, it just kept happening. But now again, despite this, there were calls that we received from travelers, workers on the train, saying that they hadn't gotten 1 or 2 meals, at which point of time I would then contact other CSOs at various states, including ActionAid, and then they would kind of go to the station and get food on board to that particular compartment or to the whole train when food had not been served. So there are multiple such instances of administrative failure.
I mean, thank you, Miriam, for sharing that. I think it's really important to recognize, and I think for a lot of people, I knew. I mean, I know. I do want to move on to the current situation, but I think since I am a civil liberties lawyer, I have to talk about the lathi charge at Fathorda, and I want you guys to comment on it because it's very important. A lot of people don't know what happened the night at Fathorda Stadium when suddenly the caring administration turned violent because they decided that they were done caring. Am I right? That suddenly that evening they decided that they were done. No more migrant trains. We are done being nice to them. And suddenly the same police officers who were kind of, helping them get in, giving them food, took out the lathis and beat them all out of the stadium, right? And I think I was wondering if either Miriam or Nupura or someone can share this because I think it's really important to sort of talk about the violence that happened. I think it was the last week of May.
So basically it was the 7th of June because 8th of June, the all India lockdown was finishing. And according to Goa government, because the lockdown is finishing, the migrants can now figure their own way home or, take a bus or a train or whatever, or find a job or whatever, because according to them, no more relief and aid and shelters are required. So after the last train left on 7th of June, the last train being before the next lot of Shramik trains again restarted, whoever was left in the shelter, they basically took them in buses to the KTC bus stand in Madgaon, dropped them off there, and then basically told them, okay, disperse. And this was from different volunteers who were on ground, anything between 800 to 1,000 people. And this was the night it rained also very heavily. And there was thunder, lightning, all that. And these people were then, because obviously they were not dispersing because it was 8 in the night and technically section 144 was still active. So, and it's not like public transport or anything was operational. So what were they supposed to do at 8, 9 in the night, whatever, 7:38 in the night? So then there was a bit of a lathi charge and stuff that is what we got on ground reports, though we've got no photographic or video evidence of it. But a few workers who had some volunteer numbers or knew, so yeah, they just told them, yeah, tomorrow everything's opening, country lockdown is over, so figure out your way home.
I mean, for the audience here, I
And
just want to
at that point,
sorry, please speak.
yeah, at that point of time, when we started receiving calls about this shutting of the Fatorda Stadium and the lathi charge and the workers again being left out on the streets in this heavy downpour, we had to, and we knew that, and this was also timed, if you remember, Alok, it was timed around 4 o'clock on a Sunday when, and between, with a very small window for the workers to actually even take the bus and get to anywhere, not that they had anywhere to go. And therefore, we had to scramble to hire buses, hire those tempo travelers, load them and ask the church and other such agencies to take them into their shelters. So Father Maverick helped at that point, and he opened up one of the retreats at Old Goa and took about 40 to 50 of the workers over there. But it was a mad scramble with very little response. We had very little time to respond because transport would shut. It seemed again completely unnecessary, because if they knew they had to do it, they could have done it in the morning, and we could have had more time to accommodate all of them some way or the other, but that didn't happen.
I mean, I think a lot of people in the audience are the actual volunteers, but I want to just say that I think the sheer kind of incredible on-time spontaneity of this community of volunteers who refuse to be called activists or leaders, and I think they really are like incredible citizen leaders in my eyes. It is a spontaneity, and I think what we're really trying to talk about today is we expect that level of spontaneity with a duty to care from the government. And I think we're not trying to be smug about this. We're just trying to tell the government this is actually quite easy to do. Am I right? It's actually really, really quite easy to do. A bunch of people just got together and fed thousands of people, made sure several thousands of people got on the trains, and I think it's really quite easy to do. And I think, and this is a really important point we want to leave in this discussion. I want to quickly mention that the Fatorda Stadium lathi charge is also linked to the coming of the fisheries, the trawler workers, and we'll be having a separate discussion on it in one of our subsequent Mondays. And at this juncture, and a sort of slightly arbitrarily, but I'm going to move on to the current phase, because I really want to come to COVID in Goa today, because all this while we've been discussing COVID-related issues, but not really COVID, because COVID was not a reality for us. So everything else was a reality for us, COVID was not a reality for us. And suddenly, we are sort of the last benchers in the country, and COVID is now a reality for us. And the whole country has moved here. No one's wearing a mask. We have a very thriving population of COVID deniers who believe that it's a global conspiracy, which is fine. This is not the subject of today's topic. But the point really is that we are now in the middle of a massive crisis. We've just experienced a fresh lockdown last weekend. Our hospitals are full. in the last 5 days, every day Goa has recorded more than 200 cases. We've had 22 deaths as of now. And the government is more and more containment zones are being declared. And for all the people partying in Anjuna, the first COVID case in Anjuna happened yesterday. So the Anjuna as a free, amazing free spirit is kind of dying out right now, guys. COVID does not discriminate. But I want you guys to comment on this, because do you think you guys will now, this GHH and and my COVID support and all the spaces you created, but are you ready to respond to this now health crisis?
So we had a GHH core team had a meeting last week where we were trying to figure out, because we knew the health crisis would be the next big thing. But unfortunately, this is something that doctors, the government has to take, lead on. It cannot be citizen supports group, because this needs medical infrastructure and specific things like, for volunteers to have PPE suits and stuff. The max that we can do from our end was that maybe, so Vijaya, for example, did a lot of research on what do you do in Goa if you have COVID symptoms. So she's put out that information everywhere. And even if anybody calls the helpline, we'd be able to give them that information. The second thing is, what we thought was, max we can do is maybe invest in a few oximeters and keep them around in different villages with volunteers. So even if somebody feels a little unwell but is not sure, at least maybe that could be the first line of defense where, okay, the oxygen levels are lower, so maybe you should call 104 or somebody should take you to the hospital or a primary healthcare center. But I don't think where the actual medical crisis is concerned, we can do anything more than a certain point. It has to be the medical fraternity and basically the government, because COVID is a pandemic and, they have been setting up centers and they have to do all this.
Nubra, my concern is up until now, we've had our previous experience of a lockdown was a lockdown without the health crisis. I think the lockdowns we will experience now will be the lockdowns in the middle of a health crisis. So you will have actually a really crazy health crisis and a lockdown at the same time. So your expertise will be required.
So see, even in the initial stages of the lockdown with the food crisis or whatever, it's never that we told the government that citizens, volunteers, if you are out of manpower, if you're out of whatever, I'm pretty sure me and all the hundreds of volunteers that were, on ground every day would have offered our help and assistance. Okay. In fact, they had the resources, they have the food grains, they have the, the voter lists and population lists, at least most of it. We would have been more than happy to, be on ground involved, because we understand that even for the government, they are understaffed for something like this. It's not happened since the last, Spanish flu outbreak or whatever that happened in the 1800s. But the point is, they have wasted the last 3 months of lockdown, because they should have at least had a disaster preparatory plan that, okay, these are the places in every village that will become, quarantine centers. This is where we will get ventilators from. This is where PPE kits will store up or shore up and keep. But nothing of the sort they have done. Even now in yesterday's paper, they're saying North Goa may have a COVID care center in Pede Sports Complex. May? When are you going to actually start doing this stuff? We are still now with 220 beds COVID hospital, which is overfull. Patients are being told 5 hours to wait for an ambulance. We have 8 ambulances only. So why hadn't they spoken to private hospitals which have ambulances, saying that, okay, if this crisis escalates, this is what SOP is going to be. Y'all are going to give us your ambulances. Y'all are going to give us your, nursing staff. We are going to set up, take over these hotels or this stadium and set up infrastructure here. But we'll need, staff, because also ultimately volunteers can help with distributing food in the COVID care centers, maybe cleaning, whatever, help find workers who can do it ourselves. But we can't do nursing duties. We can't do doctors' duties. This is something that the government should have identified doctors, nurses in private healthcare, or even retired ones, or, on a sabbatical, and told them that, be prepared. You might be called in.
I want to go back to a really basic question, and I want to ask this to Vijaya. And thank you, Nicola. I'm really grateful for what you said. Vijaya, if I tomorrow wake up and I have a sore throat and a slight fever, okay, and I live in Badem and Asagam, what do I do? With all the information that I'm flooded with, the most basic, the most immediate information I don't have. I don't know what to do.
No, so
I'm a man of privilege, and I must know this, but I have no idea. I have no doctor to call. I have no number to call. I don't know anything. What will I do?
the basic problem that I have realized from the beginning of this lockdown is that they are very poor at disseminating information, very basic information, or if they do disseminate it, it will mind boggle you. So you are completely confused. And of course, then they'll keep changing their SOPs and directives every 5-10 minutes. So it's very difficult to keep on top of anything that you're being told to do. But from the little bit of research that I tried to do, honestly, in complete frustration, because a lot of people were asking me the same question. So I realized there's a number to call, 104, but that they were also quite confused, and the information keeps changing. So from what I just received another PDF which has more COVID care centers, and there are more primary health centers, and I think there's another hospital now. So they seem to have increased the number of options that we have. Alternately, what you can do is they're these online consultations that you can do. They're not necessarily Goa centric, but if you have symptoms, you can get on Meadow or M-Fine or Practo, or Hinduja has some sort of COVID care facility at home, which they can send you. There are different price brackets for that, where you can do online consultations, and they'll send you an oximeter and a bunch of things. So you can, they'll sort of gauge your parameters and tell you what you need to do. So those are the kind of options I think that we are going to have to look at if you fall sick, because currently there is nothing in Goa. And I've been tweeting about it, and I beg everyone who is on this call right now, please get on Twitter, because that seems to be the only way people can actually hear you. Otherwise, you're just like a voice in the dark, lamenting things, but there's no point. If you really want to be heard, get on Twitter.
Vijaya really is a Twitter queen.
I only seriously got on Twitter because of this thing, this pandemic. Before that, I really hated Twitter. I still do.
The point is very valid, because actually, I think many people are arguing that the Delhi administration really changed because people went on Twitter in Delhi.
Yeah.
When they actually went on Twitter in Delhi and they said that people were dying in their homes and they had nowhere to go, right? And what scares me is while we consume all this news, we seem to think that we are immune from it, that it's not going to happen to us.
Yeah.
And that sort of an absurdly delusional self-confidence is very scary. The people are just not taking it seriously.
Yeah.
I mean, that's the point I really wanted to comment to you guys, because we are living in Goa, let's be honest. I mean, like, we are going out. We're looking at things. Are people taking seriously?
No, it's very divided, in fact. Everyone's opinions.
I mean, Miriam, what do you think? You're in Panjim. I mean, you're away from the waywardness of North Goa. Tell us.
I do see people walking around with masks. I think most of them in Panjim do stick to wearing masks. But so I think again, all this maintaining a safe distance, everything comes with privilege. If you see the accommodation that the workers are in, they're 5-6 to a 4x4 foot room. It's insane. It's meter room. It's really, really difficult. And we experience this during all our interactions with them as well. So I think the most important thing. And I just saw today on the Azim Premji Foundation page that they have created in various languages uh, posters and other things to talk about all these measures and to drive home the fact that all this is needed. How far that's going to go when we with the privilege ourselves don't follow these things fully, I don't know. And yes, we are like with the kind of facilities that we have, we're going to be pretty screwed if things escalate in terms of infections. Yes. But having said that, I also want to speak about Alok. I know that we're running out of time, so I wanted to speak a little bit about the labor directory.
Yes.
Yes. So I just wanted to share with the audience here. What we did with the data that we collected was that we created a labor directory called COVID Outreach Goa Online Labor Directory, where prospective employers could actually register through a form. We mapped workers by number, by skill, and by the area. And we have a form online where people looking for workers can put in their requirements in terms of skill, location, duration, and other such details. And at the same time, we are looking at expanding the ability of the in terms of people's movement. If you know of people looking for workers, do to make the effort of either sending us the name and number, or you can register them through our website in this very simple form, and we will try connecting them to prospective employers, because at the end of the day, there is a limit to the relief work that we can do, and there's definitely a huge limit that we are all now aware of at what the government can do. So for us, what we realized pretty early, around the first week of May, was that if we really want to help them, we need to get them work. And of course, as we work more and more deeply with them and engage more deeply with them, we realize there's a lot of endemic problems which need to be addressed. And one of awareness, of access. And so what we've taken up is to continue this work in the form of a foundation called Change on Ground, where we plan to work on grassroots in terms of pitching for health, sanitation, education, and accommodation, raise awareness for the various central government schemes that are available, and help mobilize access to this. And this, there are a lot of such organizations and central CSOs across the country. And I think we've already started working in association with them, and there's a whole lot of resources available. We just need to access it and get it across to the people who need them. So I just also want to take this opportunity to ask for volunteers, because there's a whole lot of work to be done. If you think that you would like to spare some time in helping us in various areas of this work that we have mapped out for ourselves, do reach out to us at COVID Outreach Goa and volunteer.
Thank you so much for that, Miriam. I think it's really brilliant that you actually really created a long-term sort of a path for people to really engage and for us to really help migrant workers and to also kind of really and find solutions. I think it's really quite brilliant, and I hope and I really urge people who are attending to pass this on. And if the speakers are in agreement, and we've had a really, I think we've had a really amazing discussion. I think we've had a really great discussion over the last 1 hour. We've covered a lot of topics. It was a tall task, and I think we have a range of questions, and I think I'm going to just take us towards the questions. And I think some of the questions we've kind of answered. And I think I want to just say that we have a lot of comments from people from Kerala and who are saying that they're very upset that Goa has not really kind of has been disappointing. I mean, and well, I don't know what to say to that, but we've had, I want to take a comment from, and a really important comment from Agnello D'Souza. Well, Goa Humanitarian Helpline, is it planning to pressurize the government for their lack of planning, etc.? And do you see GH, and you know, Nupura, Vijaya, Miriam, also who's broadly part of GHH, I mean, you said that, you know, of course, now when we enter into this third phase of a real health crisis, right? And you rightly said that now, you know, our hands are tied. I mean, the health crisis, the government has to step in. But can we be a voice of the people? I mean, and I think this is what Agnello is saying. Can we really kind of, can this platform be a lobbying space? The lobbies the government to provide the right kind of support for the people.
Which is why Vijaya, I mean, I haven't been on Twitter ever until this crisis, and I'm still struggling with Twitter, but whenever I can, I always retweet whatever Vijaya is tweeting, because that's the only thing that seems to get these guys going. But yeah, it will require more citizen partnership and support to actually make the government do stuff. Like one of the reasons why we did that tandem research report, though we did it in the end of May, so a lot of the migrants had gone home. So the data pool is not very high, but still now one of the reasons to do that was to act on it, to get the government to act on it. Of course, so now even with this health crisis, of course, we'll have to pressurize the government to act on it. But it has to be more citizens, you know, participating and being vocal. Of course, the media will have to be equally, you know, participatory in this. But yeah, we would at GHH because this is a crisis that's going to affect us all. So we definitely want things to change here.
Vijay, you want to say something?
The only thing that I can say is we can't just feel like victimized by this whole thing, like, oh, you know, they are so bad for us. If you really want change, you need to step out of your comfort zone and try and make change happen. It's not going to just, someone else is not going to do the work for you. It has to be a collective effort. And this whole GHH or whatever, it's actually just been a bunch of us. Like, what are we are not like some big shots or whatever. We're just regular people. We're citizens. And every single volunteer amongst us, and they have been in the hundreds, have just been regular people who got up and said, hey, you know what? I want to help out. And there are a number of ways in which you as just a citizen can help out. We don't need to be sitting around being victims of this situation. If you want change, be the change. And one way you can create change, like I said and Nupura said, is to get on Twitter. You need to have one hashtag that everyone uses and just keep going at it. Just keep using that hashtag and tag the right people. And change happens surprisingly fast. I was shocked because I'd never used this app. I really do not like it. But once a bunch of us like just started putting some stuff out, like the Railway Seva Ministry actually got back and said, you know, because it was something to do with some train and those guys didn't have food. And they replied and said, which station are they at? It's weird that they were asking me which station they were at. But whatever, it worked. The food actually reached, and, you know, things happen. It's not that we are victims. If you want change, it just needs to be done in numbers. That's the only thing. It needs to be like a bunch of people saying the same thing, and you can create change.
I mean, I want to share a really powerful story, if I may. I mean, I think, this.
Alok, can I interrupt just
Please,
before you
please,
start
please,
with your
please,
story?
please.
I would also like to give a shout out here if there is any person here who knows how to file RTI applications. Okay, awesome. Okay, I'm going to get touch base with you because that is one way I have been told by an ex-bureaucrat is also how you get the administration to do stuff. Only thing is I have never filed an RTI application my whole life, but I am willing to file it under my name, but I need help. So yeah, thanks. Carry on.
Apart from my dazzling VJ personality, I'm also a lawyer. But I want to say that there's a really powerful narrative, and I thought maybe we can sort of like try and conclude with that. And I think this is very humbling because I think this is when in the early days of the lockdown, Feli and I would go on Feli's bike and go around Asagaon. And we would discover new areas in Asagaon where there were construction sites, where hidden behind the forests, where the Delhi developers were destroying our community with other land and building more houses for other Delhi people. But they're all welcome to be here. We just don't destroy the forest. And we found these massive cavernous worker colonies. Okay, and one day we were carrying food, and some workers. So we asked them, do you guys need food? And then we started talking to them and they said, listen, they said, sir, don't give it to us. I think there are more hungry people. We have food today. You give it to the people who are really hungry. We have food today. And we didn't expect that answer. And that sort of really kind of changed our experience because we realized that idea of care, this sense of community, was not just something that we had a right over as some upper class English speaking people. Everyone felt it. And it was really powerful because these guys actually told us, they said, we have food today. And actually they only had food for today. They said, we have food today, go further, you'll find more people who really need it. Don't give it to us. And I want to end with that humbling note. And I really want to thank you all. And I think in many ways you have been great leaders because, this experience has humbled us because it's humbled us. And I thought maybe we can have a concluding comment with just maybe some sort of a personal narrative because, I know Miriam helped somebody who worked in my house get on a train to Jharkhand. And Miriam helped so many people get on the trains, fighting with the collector. I mean, a lot of things she's not telling us in this interview. And I'm sure you guys did too. And I mean, if there's a story that sort of really helped you understand the idea, and I know it sounds cheesy, and I know we are Goa, and Goa and all that, we're supposed to be cool and all that, but fuck that. So really, tell me, let's end with something like that. Let's really, I mean, how did it change you guys? It has to be something powerful in this experience.
Okay, for me personally, I think there have been loads of experiences, but one that really stood with me was similar to yours. So there was this bunch of workers that once they had stopped the Shramik trains, and because the numbers in the middle again when they had stopped and numbers were very low, they put these workers on a passenger train to Delhi. Now passenger train means it's not a Shramik train, so they didn't get any food or anything, and they would have had to buy food and water. And we got to know they were being put on a train like 1 hour before the train left when they were taken to the station. So at about 11:30, 12, we are scrambling because they have been given dinner at 8 p.m. at the shelter and then nothing after that. So reached out to, friends, volunteers, and, checked the online route. All of us volunteers checked the online route. Saw, okay, the train stopping at Panvel, then at Bhopal, then at blah, blah, blah. Reached out to everybody, managed to arrange food and water. But what happened was this train also had a stop in Nasik before the dinner station where we were planning to put dinner on the train. And some local citizen volunteer group in Nasik was basically on the station, I think, throughout the day, and whichever trains were coming, they were asking if anybody needed food and just giving food, free. So these workers got food from these guys. So they immediately call me and they tell me, madam, you know, नासिक में एक दो अच्छे मैडम आए ट्रेन तक और खाना दिया, तो आपने जो भोपाल में खाना अरेंज किया है ना, वो नहीं बोलो, है अभी रात के लिए हमारे पास खाना, किसी और के लिए दे दो. And they're calling me on the train with bad connectivity and everything, you know, and telling me that. So I called the volunteer in, sorry, not Bhopal, it was Ahmednagar. The train was reaching Ahmednagar that night. And I told him this, and he said, madam, don't worry, at least they'll have for breakfast then. It's okay. My volunteers are ready, it's arranged. But imagine these guys, like, they had that much thought. These guys who've been struggling, living in that shelter for days with bad food, bad water, bad everything, sleeping on the floor, and calling me to just let me know that they got food from some nice volunteer ladies in Nasik, so to not arrange dinner in the night for them.
Fantastic. Miriam, do you want to share something as a concluding comment, and we'll end with that?
I just feel that the power of the collective is enormous, much more than we realize. There are things that I never thought that I'd be sitting in Donapal and helping people from Chhattisgarh who've been dropped off in Orissa because the train didn't stop in Chhattisgarh. I'd be organizing buses for them from Orissa back to Chhattisgarh.
Wow.
I could do this, and I could do so many more things because of the power of the collective. I just had to reach out, and there would be people just like you and me all over who would scramble, work with the administration, against the administration, whatever they needed to do, but get the job done. And it's just about getting the job done. Absolutely. The will to get the job done, and the empathy, which clearly was lacking in the administration.
Vijaya, you get the final comment, but it cannot be about Twitter.
Oh, okay. You know what? I always, in the past few years, I just felt like such a misanthrope. I'm like, oh my God, people suck. And, you know, just generally, what the hell is going on? And, you know, like in the world. But this experience has really renewed my faith in humanity. And though everything is very divisive and everyone has, this is my opinion and that's my opinion, and, you know, I will, my way or the highway, whatever, that's also going on. But this entire experience, the way people have just come together with just one intention, that's to help out. So all your opinions, whatever, keep it on the side. Everyone just had that one intention, and that intention was so pure that we actually managed to do some amazing work. And I know we're just three of us sitting here, but it was a collective effort of so many people. And also the guys and so many people that we were helping, you know, it was like, I haven't really, like, I never really noticed that there were those many people. But when we were actually talking to them on the phone and they were telling us, you know, I live here, these are pictures of my family and my mommy and daddy, I really want to go home. I actually had like this emotional connection with them, and I was like, oh my God, where are they? Have they reached? And like each one of them, you know, like you're thinking, and it just became like an emotional thing, like, because these are actually people. And
really?
Yeah, it was amazing. So it's just like, for me personally, it's just like brought out a lot of stuff, and it's although it's been crazy, it's been a very eye-opening, amazing experience. And yeah, and I think yeah, together a lot can be done. We just need to organize and figure stuff out.
Guys, at this on that note from Vijaya that we are together, it's 8:50. We've had a great, vibrant 1 hour 45 minutes discussion. I think it's one of the longest discussions online. I thank all three of the speakers for being such instructive leaders. I know that I know that you underplay your role, but really thank you so much for inspiring all of us. And there are many more people who really played fantastic roles, who really led this sort of citizen effort. And I guess we could just say, all of us, I mean, there's all these thank yous pouring on the comments. And I just, on behalf of all the people attending, thank you. And it's a collective thank you. And thank you so much. And the work is not over, clearly. And we are in the middle of the third phase. So let's take it seriously. For everyone who's attending, please take COVID seriously. Please wear masks. Please follow the guidelines. It's very serious. It affects anybody and everybody. And do not add to the crumbling infrastructure of the Goa health system. Please, I mean, and you can actually contribute to that by taking care of your own sort of exposure. And please try and do that. And thank you guys so much. Thank you so much. This talk will be has been recorded. It'll be uploaded on live on our Dust Live YouTube channel. You can always watch it. Tell other people to watch it. We'll share the link also. Thank you guys. Bye.
Thank you.
Bye guys.
Thank you.
Thank you all.